and thank you for everyone for tuning in to another wonderful Wednesday. I have a very, very special guest, which all my guests are very special. And I just want to say it's really a wonderful day to wake up and to even be able to do this today because there's so much going on in the world today. So my prayers and heart go out to everyone who is going through struggles, and I try to bring shows that to the community and the world at large, and avenues and different things to help us to heal better. And because there's so much going on in medicine today, and not just medicine, and integrative health care. And my wonderful guest, Dr. Howard Elkin, is going to be talking about this. He is a board-certified cardiologist. And I just want to thank you so much for being here with me. And we share so much of the same thing, and you're going to be talking about why you are a medical advocate as we go through this journey of this conversation today, of this interview. But first of all, I do want to thank you very much for being here today, and I want to thank all of my listeners for tuning in to the Cherilyn Lee Health Show with your co-host, Dr. Cherilyn Lee, and today my guest, Dr. Howard Elkin. Thank you so much.
Thank you. I'm privileged to be part of your program today. Very, very happy to be here.
Well, thank you. You know, the reason for bringing you on, the vast amount of wonderful energy, but you happen to provide a service, and our topic today is dealing with EECP, and I'm going to let you explain what that means, because some people probably have seen that and said, "Is that a new supplement?" So I'm going to let you explain what is EECP.
Great. Okay, EECP stands for Enhanced External Counterpulsation, which I know is a very long term, which is why we say EECP. But it is a non-invasive treatment modality, and this is how it works. We put cuffs around a patient's calves, their upper legs, and also their buttocks. So there's 3 sets of pads, and they're inflated and deflated by a generator. So it's kind of like having a large blood pressure cuff, and it's timed to your EKG, your heart rhythm. So in the critical part of the cardiac cycle, when the coronary arteries are being filled with blood, these cuffs are being sequentially inflated and deflated. So we're increasing blood flow to the heart.
Right.
And
you know, I'm going to slow you down just a little bit, because I want to make sure, even though I have a lot of practitioners and doctors who are listening to the show, but we have a lot of people that I want to make sure they understand. And we're using some terminology, and so I want to kind of break down a little of the anatomy so they can get the whole picture, because they're not seeing this.
Sure.
So if we could just, it's like you said, a blood pressure cuff, but it's large.
It's large.
The calf, which is like behind your knee.
Mm-hmm.
And another one that goes where? Across the hip area?
And, well, actually, one is in your calves, one is in your is above the knee, and then one is in your buttock area. So there's 3 sets.
Okay, so it's 3 sets of like EKG, not EKG, I'm sorry, like a blood pressure cuff.
Exactly.
So to make it clear, there's a cuff. It's nothing someone's going to insert, and it's nothing you're going to be taking. So
absolutely.
Exactly. So I just want to make sure that's clear. And you spoke about the coronary artery. So let's just talk about that a little bit and the importance and why this is so significant, a treatment dealing with that type of circulation.
Well, if you look, Dr. Lee, whether you're talking about men or female, black or white, across the board, certainly heart disease is still the number 1 killer in this country and in the Western world. And so many people suffer from coronary artery disease, in which they simply are not getting enough blood flow to the heart. And the end result of that, of course, is a heart attack. So whatever treatment we're using, in this case EECP, we're trying to improve the circulation to the heart to avoid a heart attack. Yeah,
and now we talked about coronary artery. So each time I'm going to kind of bring you back, only because I like people to walk away from the show and say, I vaguely remember something about my doctor said coronary artery, but he didn't tell me where is this located. So,
absolutely.
And what does that mean? So
if you look at the heart muscle, there are 3 main coronary arteries. and little branches. So these three main arteries supply your entire heart muscle because a heart has to work 24/7. So it has to have a very rich supply of blood and oxygen. And that's why we're so dependent on these three large coronary arteries. So that's really what we're talking about when we're talking about coronary artery disease, in which one of these or more of these three arteries get plugged up with plaque. And when we talk about treatment, we're talking about how best to get past this problem.
Wonderful. Because, a lot of people say, I had a triple bypass, I had a double bypass. And when you're talking about bypass surgeries, you're talking in regards to the coronary arteries, right?
Correct.
And that's what some people realize that, and a lot of people don't. So EECP is actually indicated for what type of patients or people with what type of conditions?
It's indicated for people with what we call angina, or angina just means chest pain related to not enough blood flows. So chest pain on exertion, which is related to heart disease. So whether you're having chest pain at rest or chest pain with exertion, it is definitely indicated for those patients. It's also indicated for patients that have had repeated stents or bypasses and they don't want any more, so it's sometimes a matter of choice. And some people are not really suited anatomically. Their anatomy doesn't really make them suitable candidates for bypass or so forth. So it's a great alternative for those with chronic heart pain, or the term we use is angina.
Okay, so I'm going to kind of go back again to EECP, and this is a treatment, and I want a person to close it. I mean, if you're working, so if you are a family member or candidates, and we're going to go through who is this really is good for, and who is basically is contraindicated for. Also, we're going to be going through that, but I want you to visualize this is a non-painful treatment, and you're lying down on a bed, and I'm going to let you take it from there, Dr. Atkins, and let them visualize what type of treatment this is, because a lot of people are familiar with it, but there's an awful lot of people who are not.
Exactly. And first of all, Julie, just to give a little bit of historical perspective, if I could, it's not. Some people think this is new. It really was approved by the FDA in 1996.
Oh, 96.
Yes, and it was quickly approved by Medicare 2 years later in 1998. And then in 2004, I believe, it was indicated for heart failure patients. So it's been around for a while. A lot of people don't know about it. So I just wanted to bring that part out. Now, as far as the procedure itself, a patient comes to a center or a place like my office, and they lie on a table, and the nurse puts these cuffs around the calves, the area, the legs above the knee, and also the buttock area, and they lie. And what happens over a period of an hour, and each treatment is an hour, these cuffs are being inflated and deflated, and it's all powered by a generator. And it's kind of like getting like a deep tissue massage, but no one's really touching you. It's just the inflation and deflation compressing your legs. So you're really getting a soft tissue massage, deep tissue massage, and it's an hour long. It's generally thought to be pretty comfortable. A lot of patients sleep through it. And that's it. It's painless. And it's passive. You just lie there, and the machine does the work. And, of course, the nurse is there to ensure that everything's going okay. And your rhythm is being monitored the entire time. Because, remember, the machine works off of your heart rhythm. So your heart rhythm is being monitored the entire hour.
That's amazing. So now, what if a person... what are the indications? And we want to go through that. So a person who feel like, I have high blood pressure, I don't know if I'm a candidate for this. What are the indications, or what are some of the other conditions where a person, I think I kind of asked you that, but I want it clear to our listening audience, because you don't just come into a doctor's office and, someone's going to put you on the table. You're going to have to go through a series of examination by a cardiologist. You have to be examined by a cardiologist. And there's other tests that I think you have to do first to see if you qualify for this type of procedure after going through a complete, thorough history and physical from the doctor.
Exactly, absolutely. And the interesting thing is, remember, excuse me, coronary artery disease is so prevalent. Like I said, it's over 50% of the population has some form of it. So what we're looking for, people that have chronic angina or chest pain, or let's say they've had a stress test of some form, and the stress test is positive. So those are indications for having some type of treatment. Because, again, we want to avoid at all costs a heart attack. That is our, we want to, well, two things. We want to always avoid a heart attack and subsequent death. We also want to improve patients' symptoms. We want them to be able to do more with less effort. And that's where EECP comes in so handy.
Wonderful. And if you could speak up just a little louder for me, just a little
Sure.
louder for our audience to hear. You know, so after going through a complete examination, and if you have symptoms or family history, I always suggest a person, be checked out or go through an exam to find out where they are before they have a symptom. Because a lot of things are called silent killers for a reason. So, on a regular basis, have your blood pressure checked, have your blood sugar checked, and not just blood sugar. Sometimes it goes a little bit deeper, but it's good to know these things ahead of time. Doctor, now let's talk about some of the risks of this treatment.
Great. Well, that's a great thing about this treatment, Dr. Lee, because, first of all, there's really the only side effect. Some people will get an irritation where we apply the cuffs to the skin. I mean, that's the worst thing that can happen, and we can fix that easy by adding some material, any number of things. It's a mechanical thing. But as far as the risk, so that's a side effect. This is safer than medication because you aren't taking anything into your body. It's an external process. And
Yes, you are not taking anything into your body.
Right.
That's
No
the big
IVs
key.
involved. No intravenous stuff.
Mm-hmm.
Now, as far as any risk, well, this is a kind of a list that we use. First of all, uncontrolled hypertension. We want the blood pressure to be, it doesn't have to be perfect because EECP in itself works beautifully because it helps to relax the blood vessels and the heart will work with less effort, so the blood pressure will naturally come down. But, of course, if the blood pressure is way out of sight, then we would want that to first be controlled. Also, if the heart rate is, let's say, over 110 or so, we would want, because it works more effectively when the heart rate is slow. So we want to make sure the blood pressure is within an acceptable range and also the heart rate. And those aren't
So
really...
you said the heart rate shouldn't be over...
Definitely not above 110, 115.
Okay, so anybody who has uncontrolled or history of atrial fibrillation
Exactly.
should not.
Right. But I wanted to state that atrial fibrillation is fine with this procedure as long as the rate is controlled. And that's not difficult to do in this day and age. It should be relatively easy to control the rate. So we want to make sure that the heart rate is controlled, whether it's normal rhythm or fibrillation, which is the most common heart rhythm abnormality in people over the age of 70, and also that the blood pressure is not uncontrolled. It doesn't have to be perfect. We just don't want it to be out of sight.
Right. And what are the, because I have known about this for a long time, the EECP, and another very dear friend of mine was telling me some of the serious contraindications, and I want you to kind of go over those with me. What would be an indication where a person should not have this treatment?
Great. Okay, first would be uncontrolled hypertension, like I've already mentioned. Second would be if they have an aneurysm in their aorta. So before any patient undergoes treatment with EECP, I do what's called an aortic ultrasound. I do it in my office. It's about a 15-minute procedure.
Can you say that again a little bit slower and a little bit louder?
We do an ultrasound of the aorta, which is that large blood vessel that goes to all parts of your body, and we want to make sure the patient does not have an aneurysm. An aneurysm is a weakening of the wall of the aorta, and it tends to, when it weakens, it starts to balloon out. And if that needs to be checked, because that could certainly eventually rupture, and then you are dealing with a very ominous situation with a high mortality rate.
Right.
So all of my patients, before they undergo EECP, we do an ultrasound in my office, and we rule out the presence of an aneurysm. Now, an aneurysm is okay as long as it's not large aneurysm. So with an ultrasound, you can actually measure the diameter. So if it meets that criteria of not being really large and in need of surgery or intervention, then they are candidates for EECP. Another contraindication is someone with acute heart failure, because just the added, while we are using the inflating cuffs on the legs, we're going to be increasing the blood return to the heart. And that's fine in most cases unless a patient is in active heart failure. But that said, it's a great treatment for those with chronic heart failure that is controlled, because it actually, over the long term, improves the function of the heart by relaxing the heart muscle so that it pumps more efficiently. So, and that was added to the list of indications, I think, in 2003 or 2004 for chronic heart failure that is compensated. But if a patient has acute heart failure and they're ill, obviously you would not want to put them on the machine.
Right. So I just want to go back a little bit on acute and chronic, because a lot of times, people are not aware what acute and chronic, and I think
Right.
you just sort of covered it, but you have
acute chronic failure is a person that is having shortness of breath with minimal exertion. They have a lot of swelling in their lower extremities. You hear this term all the time, CHF, or congestive heart failure.
Mm-hmm.
But there's acute heart failure, which could be life-threatening, and there's chronic heart failure. I have tons of patients that have chronic heart failure and that are living pretty productive lives.
Yes.
So, with both nutritionals and pharmaceuticals. So those are the ones we want to target for EECP. But the people that have, and the acute throngs of heart failure that are symptomatic at rest, of course, those would be the ones that we would not want to put on the machine. Does that make sense?
Yes, it does. I just want it very clear for my listening audience, too, because it is a treatment that, that I find kind of non-invasive, but not only that, it is a treatment that really has helped a lot of people. Now, what about contraindications for people who have cancer?
Okay. It's not contraindicated for people with cancer per se, I should say. It's not a contraindication for EECP, but I would be fearful if they have what's called metastasis or spread of cancer to the bone, because, again, it's like a deep tissue massage, especially in the lower extremities. So that would be a red flag for me. I would really have to investigate that patient further. I would want to speak to their oncologist. I would definitely communicate with the entire medical team. So again, cancer per se is not a contraindication. It depends on how advanced that cancer is. And again, if there is spread to soft tissue or certainly to the bone, then we would want to be very, very careful. So again, medical evaluation is mandatory. We don't just put anybody on this machine.
Yes, because my understanding is it causes vegetation. If you put a person on ECP and they already have cancer, that it will cause, especially with the metastasis, like you said.
Right.
Yeah, it will cause that.
So I would never, if I saw a patient with cancer, the first thing I would do is to get their records, and I would definitely confer with their oncologist to see what stage they're at, and really put all this together and see, okay, what are they most likely to suffer from, the effects of heart disease or cancer? And it's always a weighing, you have to weigh the process, but that is definitely a red flag, absolutely. And that would require, again, why medical evaluation is so important. We don't just put anybody on this machine.
No. Yeah, because I've seen where, people have been able to just try out machines. What do you say a person who have had a history of thrombosis or blood clots or pulmonary embolisms or any
That's a
type of blood clotting problem?
great question. It is not contraindicated unless they have an active clot. If they have let's say they have a history of what we call deep vein thrombosis in the legs, but it was like 2, 3 years ago or more. That in itself is not a contraindication, but what I would do, and again, I do this in my office, I would do a venous ultrasound, which is a 20 or 30-minute test. We would go through both lower extremities to make sure that there is no active clot. If there is no active clot, it is a safe procedure. And even if a patient, by the way, is on Coumadin or one of the newer agents we call the blood thinners, that also is not the contraindication. So as long as it's not active disease, and again, that requires some ancillary testing. Hello?
Yes.
Oh, I'm sorry.
I just want to
Sorry.
say too, so if a person is scheduled to go in for a start treatment after they evaluate it and have all the tests, what is the duration of treatment
Great.
before they would follow up to see if this is actually working for them?
Perfect question. First of all, just so that everybody knows, each treatment is an hour long, and Medicare and the private insurers cover usually 35 treatments. So we tend to we like the patients to come 5 days a week if they can. So 7 times 5 is, a total of 35. So 7 weeks would make it a complete treatment. And as far as people seeing results, it tends to be, this is my experience, around day 14 to 16, they start seeing the effects. They can do more, they're having less chest pain, they definitely are feeling more energetic. People can generally tell a difference by the 15th treatment. And that seems to be across the board, Dr. Lee. I've confirmed with other people that do EECP. And so it seems to be between 15 and 20 treatments. But keep in mind that each cycle is good for 35 treatments. And something else I might want to mention, when this first came to be, Medicare said, okay, well, one treatment cycle for life, which is kind of ridiculous because that's like saying one size fits all. That's no longer true. You can have repeated cycles of EECP at the physician's discretion. Medicare will cover that, as will most PPOs, and that's important to note.
And that is so important to know, and I really, really appreciate it. I just want to say, if you want to call in, if you have any questions, you can call into 310-928-7733. If you have any questions, you can also email us at innerlightradio@yahoo.com. So I just want to say that, thank you for providing those answers to those questions and the studies. And if a person can, let me just ask this question too, because there was a person that I had met, and he may be calling in, but people with certain type of back conditions. Is there a special way that a person can be placed on the machine based on the fact that they have like scoliosis or a pinched nerve because they are lying down?
That is a great, great question. Well, what we do in these patients, yes, we have extra padding we can use. We do what's called a trial. We don't charge for this. If they have a back condition, because everybody is different. I've had back surgery myself, so I know about back deformity. But if they, and it really depends. There have been a few patients that just can't tolerate it, but most can. I've had some patients that have had repeated back surgery that have no problem. So again, it's an individual thing, and we'll give them a trial session, and if they can tolerate it, and again, most can, it's fine, and we'll try to improvise with certain padding, etc. And if they can't, well, at least we gave it a try. We can't tell without putting on the table because everybody's got a different back issue. So, but that is a trial and error. and we're willing to work around that.
Okay, that's really good to know because I know. Can you do this sitting up without instead of lying down?
It's well, of course, you want the patient recumbent. We can. We can't have them really sitting up because of the way in which these cuffs work,
Mm-hmm.
the sequential inflation and deflation. But we can prop them up slightly at an angle. We've been able to work around most of these problems. I think, Dr. Lee, I think I've had two patients that come to my mind right now that just could not lie still for an hour at a time and to go to treatment. But I think one patient had like 3 laminectomies, and the other one had laminectomy, shoulder replacement, hip replacement, just a ton of orthopedic problems. So, and then there are only 2 that come to my mind at this time. Most are able to get through it because it's generally a pretty comfortable procedure.
Oh yes, I actually have been on a machine and it did feel really good. It felt good. I just didn't think, based on some things with myself, that it was for me, but it really feels good, and I have recommended it to patients, and it's always good to know when you're going to refer someone out, especially a lot of people who have insurance, and this is covered by covered by Medicare. Is it covered by Medi-Cal?
I don't know if it's covered by Medi-Cal. That's a very good question. It's definitely covered by Medicare. It's definitely covered by most PPOs. If it's a workman's comp with heart disease, it's generally covered.
Wonderful.
And it's very interesting, too. I don't have an HMO population, but there have been several HMO patients who are able to get this through their HMO, and the HMO will directly contract with me for the provision of this service. Now, I'm not saying that across the board, but I've had a few instances in which the patients have gone to Kaiser or their HMO and say, hey, this is a modality that you don't have, this doctor has it, and I'm a paying member, I should have this plan. So it does require a little bit of work on the patient's behalf, but if that's the case, I have had HMOs contract with me on specific patients because it's a great treatment modality and no one should
It
be excluded.
is. And I don't want to cut you off, but we have a caller. Caller, can you state your name and where you're calling from?
Hi, my name is Kayla, and I'm calling from the Antelope Valley.
Hello, Kayla. How are you doing today?
I'm blessed, and how about yourself?
I'm truly blessed. Thank you. And thank you for calling in. You have a question for our guest, Dr. Howard Elkin?
Yeah, I have 2 questions. My first question is, can the EECP therapy be used as a preventative measure for someone that's like obese or have any other risk factors that are associated with heart disease?
Okay, that's a great question. And I wished I could tell you yes, but it's not covered by third-party payers for that reason. And I think it would be very useful in diabetics because diabetics have a very high propensity of developing heart disease. Eventually, about 70% of diabetics will develop heart disease or stroke in their lifetime. And so many of those heart attacks are silent. Diabetics are a different population, and as you know, this is a growing epidemic in our country. But at this stage, it's the whole thing about penny wise and dollar foolish. They'll treat disease, but they won't treat prevention. So I'm with you on
sad.
this.
That is
and
so sad.
It's upsetting and it's sad, but there are people that what we'll do in people that have that kind of interest is we'll develop a special cash program so that they can undergo the treatment out of cash, and we'll give them a great discount. But unfortunately, the third-party payers are really, really strict.
Correct.
They want you to come in with illness.
Okay. So my next question is, with the EECP therapy, is there a specific diet and lifestyle that accompanies that?
Great question. Well, I always recommend that patients be active when they're undergoing the program because I want to really see, as a physician, as a cardiologist, how effective this is going. So I want them to exercise. I always encourage exercise with or without EECP. And there is one dietary thing that besides a healthy diet, one supplement that I really, really like, and it's D-ribose. That's D with a hyphen, ribose, R-I-B-O-S-E. That's a 5-carbon sugar, so even diabetics can take it safely, and it will not adversely affect their blood sugar levels. And what that does, it actually works in concert with EECP. It helps to relax the heart muscle. When the heart muscle is relaxed, it can pump with less stress. So it's great for heart failure. It also will improve the perfusion of blood through those coronary arteries. That's what we're trying to do. We're trying to improve circulation. So exercise I like to do, and I like to add that one nutrient, D-ribose, to anyone undergoing EECP. And, of course, a healthy diet along with it.
Yes, that is so important. Especially, I'm sure you're looking at their cholesterol levels and their homeocysteine blood tests, and these are very important, tests and inflammation markers.
So important.
We talk about the C-reactive protein. We've spoke about it on the show before, and those things are really important. But to add nutrition, and we're going to get into that a little bit more. Some nutritional supplements that are great for your heart and
Absolutely.
for cardiovascular. So we will be talking about that on the show. And if you just tuned in, I want to thank you so very much for tuning in today to the Cherilyn Lee Health Show. And we're at the CherilynLeeHealthShow.fm. So go in and like us on Facebook. The Cherilyn Lee Health Show. And my guest today is Dr. Howard Elkin, and he is a board-certified cardiologist. And I do thank you so much for being here today. And we're speaking on, all this wonderful treatment modality or treatment plan, EECP, that is a device or a machine to help you with your cardiovascular health. So in a few minutes, and just in case you just tuned in a few minutes, we're going to kind of do a recap quickly to kind of go over a couple of things, because we did move our show hours, timing from 11:30 to now we're on at 11 to 12:30 Pacific Standard Time. So if you just tuned in, thank you so very much. And if you have any questions, don't hesitate to call us while we're on the air live at 310-928-7733. Or if you want to email a question, you can email it at innerlightradio. That's INNER, lightradio at yahoo.com. I want to thank you so very much again, Dr. Elkins.
My pleasure.
So D-ribose. Thank you so much for sharing that about the D-ribose, and it's safe for diabetics.
Absolutely, because you have to remember dextrose and glucose, which are the offending agents, and certainly what we need to worry about in diabetics, those are 6-carbon sugars. D-ribose is a 5-carbon sugar, and it's in every cell in your body. We can't survive without it. I call it the raw material for every cell to generate energy. And like I said earlier in the show, the heart has to work 24/7, so we need to help it nutritionally. And that's where Western medicine, I believe, has failed. We have great drugs out there to prolong lives and to keep people out of the hospital, but what are we doing to nutritionally replete their heart muscle?
Exactly.
And I think that's a big piece of the pie.
Yes, so we're going to go into now and talk about some of those nutritional supplements that are wonderful for the heart muscle and for the heart tissue and for cardiovascular health, so your heart and your vascular system. So I'm going to let you open that up, because D-ribose and what you're going to discuss is things that I've been working with for a long time, and it's been truly, truly amazing. I love D-ribose. I take it myself.
Great. I do too. And, I've told a lot of people that although I don't have a problem with my heart muscle per se, I work out quite a bit, and it really helps in my recovery, because the heart is a muscle, and of course you have all these skeletal muscles, and if you work out hard, if you're a marathon runner or a bodybuilder or a triathlete, doesn't really matter what, if you've worked out hard, your muscles are going to be nutritionally starved after the workout. So as we get older, we really want to make sure that we recover. And that's where D-ribose comes in. And I could tell a difference within 10 days when I started this D-ribose about maybe 4 or 5 years ago.
Yeah, and I started it with some NBA players. some years ago too, and it was amazing the outcome. I had them to mix it with a couple other things they were taking, and the outcome was amazing. So D-ribose is a wonderful, wonderful, especially you can get it in powder and just put it in your drink there. So it's a very powerful product. So we're going to move right along because it's
Wait, there are a couple of, let's see. So D-ribose is what I consider the raw material for energy production in all the cells, but of course we're focusing on the heart today. And the other is, you know, that everybody must have heard of coenzyme Q10. And that's a really important nutrient because that's part of what we call the electron transport chain, which I know doesn't make much sense to most people, but we need that electron transport chain for the cells to produce energy. And it needs CoQ10 or coenzyme Q10 for that to happen. So that's part of the energy working machinery of the cell. So if you take that and couple it with D-ribose, you got a great combination there for energy for the heart as well as for every other cell in your body. And the last one is the L-carnitine. And I don't know if readers know, your listeners know this, but about the heart depends on fat for about 60% of its energy stores.
okay. Can I say that again and a little bit slower because I think that's so important.
Yes. Fat is a major source of energy for the heart muscle. And that's very interesting to know. So what L-carnitine does, it transports fatty acids, which is a component of fat, a breakdown component, to the energy powerhouse of the cell. And I hate to throw out all these big words because I know it's just a bunch of medical jargon, but those powerhouses are called mitochondria, and I'm sure you have some sophisticated people that know that. So think about this. You have the L-carnitine, which transports fats to the mitochondria. Okay, then you've got the electron transport chain there with the CoQ10, so it's ready to produce that energy, and you've got the D-ribose as the raw material. So if you've got those three materials, then you're going to have a nutritionally sound heart.
Yes, we are, and I just think this is so wonderful. Now, the quantity, and is it how, and I tell people all the time when it comes to supplements, that don't just buy any type of supplement. You want to really, I really feel a person should be assessed, or, because that's what I do here at NutriMed. I go through and really assess patients very thoroughly when they come in. So and know where products are coming from, because you don't want to just pick up just anything or from one particular company and not knowing, if it has fillers in it and all these other things too. So it's really important to know exactly what you're getting, what you're taking, and then how to take it, and then you don't want to overdo it with anything.
And I just want to say, I so agree with you on everything you've just said.
And if you're taking medication, you got to know, how do you take a supplement with medication? Because so many people, a lot of people come to me and it's like, well, I can't take something, my doctor said don't take anything because I'm taking medication. And most people kind of know my history of being in a couple comas and the whole 9 yards and malignant hypertension in the past. And I do take supplements, but it's when you take supplements. So if you can kind of talk about that, the safety of taking supplements with medication.
Great. Well, first of all, I want everyone to know that there are certain medications that deplete you of things that you need in your body, of
exactly
that you need. For example, a lot of people don't know this, but statins, which are the most widely used medication to lower cholesterol, will deplete you of coenzyme Q10. And also beta blockers, which is another a big class of medications also used in cardiac patients. So, and I have patients that have been on both beta blockers and statins. So you have a double whammy here. So both of these medications deplete you of CoQ10. Now, we may want to lower cholesterol, but we don't want to lower CoQ10. That is not what we want. And a lot of people develop, I'm sure they've heard this, muscle weakness, muscle pain. And the pharmaceutical companies and Western medicine never really address this, but I learned this through my fellowship in anti-aging medicine. It's the low CoQ10. So and I do have to use statins because I have a high-risk group, with my cardiac patients. I don't use them uniformly. I try not to use them when I don't have to, but when I have to use them, I do. I always prescribe CoQ10 whenever they're on a beta blocker or a statin. Very important.
Right. Now, we say statin, a lot of people don't know there's, I really feel if you have to go that way, because some people, and I have relatives that, they don't want to do it any other way. But we have had, it was a very interesting case with a lady. She went to her doctor and her cholesterol level and everything was over 300. The good, bad fat, that was out of range too. And so she came to me with her results and said she wanted to do something. Because she just watched her mother go into this early phase of dementia and Alzheimer, which there's a lot of material out there that shows how the statin medications will do that. And she just didn't want to do. She said, "I'm just not going to do it." So I gave her something natural. Her cholesterol levels started to come down, but it came down really, really well. And I'm thinking, what did you do prior to having your lab work done, even though it's fasting and everything with your doctor? And she said she ate shrimp. They had them on sale, and she ate shrimp for a week. Well, it threw her cholesterol level. You need to ask a lot of questions with people when you're doing blood tests and everything. Her cholesterol level was so high, and that's why it came down so fast, because she had she had it every night. She ate shrimp every night for a week.
And it came down.
Oh, yeah. Yeah.
Which is really interesting, and because a lot of people are afraid to eat lobster and shrimp because, quote unquote, it's got high cholesterol. But you have to know it isn't the cholesterol in shellfish that makes a difference, because if anything, it's so low in fat, it can't be anything more healthy to eat. I'm more concerned about saturated fats and trans fats, and those are the things that are going to screw up your cholesterol levels. So I'm really glad you mentioned that, because people are afraid to have eggs, for example, egg yolks, and shrimp and lobster because of the cholesterol content, when actually that can help with cholesterol. Isn't that funny?
Mm-hmm.
That's great. And I agree with you. I use different types of supplements when I can on a lot of my patients with cholesterol. I feel this country is over-statinized. Pretty soon we're going to have statins in our drinking fountain. It's ridiculous.
And when we say statin, listening audience, we're speaking of a medication that they would give you to lower your cholesterol level.
Right.
There's been a lot of studies, and you tell me what you have found in your studies, that bringing the cholesterol level down lower than, I was told, lower than 100, your chances of developing certain conditions, including cancer, was very high. So
I agree with you.
What have you found in your studies? Because I had a patient who came in, and he had been on a cholesterol-lowering medication. He had been on that medication for several or many years. So when I asked the family and him, what are your levels, and you don't want to get it down too low, and they said, well, we don't know. Nobody ever asked us. No one checked. They just keep refilling the medication.
Right.
And so his level was so low. I think his level was like 92.
Mm-hmm. Yeah.
And he was already in dementia. He already had diabetes. He was having so many other problems as it dropped. There was a good book. I don't remember the author's name. It was called Lipitor, Thief of the Mind. And it was written by an MD. So it happened to my mother also. Once they had put her on the statin drug, she went into early dementia. So I try to tell people, if you're on certain medications, and you're not going to get off, you're going to stay on them. Like I have some family members, and one now have muscle wasting really, really bad. Then you want to do things nutritionally to counteract some of the side effects that are going to occur.
Absolutely.
Yeah.
And it's really interesting. I agree with you. First of all, I check lipid levels scrupulously in my patients, and I had people come in that have been seen by other cardiologists, and their cholesterol levels are like, like they're 100, like you say, 90, and the LDL, which is the bad cholesterol that causes plaque, is like 40 or 50. I said, this is like way too low. I'm a the only cardiologist that actually decreases levels of statins. I mean, so many people out there are just over-medicated. It's ridiculous. And you are right. There's a reason why cholesterol is needed in our body. It is the precursor to sex hormones, to vitamin D, to bile acids, to cell membranes in our brain. I mean, without cholesterol, we would die.
Yeah.
And there's also an increased incidence in suicide and cancer in patients with really, really low cholesterol levels. So,
and
yes.
I want you to say that what you just said, that whole little paragraph. Can you say that over
I get so
a little bit slower? Because the sex hormone, I know we get everybody's attention when you say that, but and people need to know that, because a lot of people who diets or one thing or another, and they just stay with the same food. So sometimes that's not a good thing. You want to mix up your food, even if you're vegan, you want to mix up your foods and not eat the same foods every day, and make sure that you're getting the right amount of good fat, and make sure your cholesterol level isn't too low, because I see that a lot in a lot of people who maybe they just say, I'm going to leave fat alone. There was a very famous program. They came on the market that actually it came on the market through hospitals, and without mentioning the name, that there was no fat in the diet, none. And oh my goodness, I can't begin to tell you the number of people that got into serious trouble.
Right.
Serious trouble with this, because it was a protein based and no fat.
Right. Fat is not a bad 3-letter word.
No, it isn't.
But getting to what I was saying, and I get so passionate that I start talking faster. So excuse me, audience.
That's okay. That's okay, and so am I. But I
see this all the time. But we all need cholesterol. There's a reason why our higher power gave it to us. It's a building block in our bodies, and again, it's necessary for the production of sex hormones, vitamin D, cell membranes in our brain, bile acids, and a few other things. So really, we really need cholesterol. Now, of course, if you are diabetic or you have coronary disease, we have to modify that somewhat, but we never want it that low. So I differ than so many other cardiologists. I think it's ridiculous how it's a blanket statement that everyone should have an LDLs in the 70 range. I mean, who's a purist? I want my patients to be healthy overall. I'm not going to look at just an LDL or a cholesterol level. I'm sorry, it's the whole patient that makes.
You look at the whole patient. This is why here at NutriMed I practice more functional medicine. How are you functioning? We do tests to, like our CRT test. It's looking at you where you are right now, and how your body is functioning right now. So it's really important for a person to know, on a functioning level, how are you functioning right now, to keep you in somewhat of a normal range, but keep you functioning. It was odd because I had a lady just tell me yesterday that her husband was having dialysis done, and he's not a patient of mine. And when she went over to one of the major hospitals, they looked at her and said, "Wow, are you anemic?" Because she looked like she was, and she is. She does have a condition. They said, "Whoa, well, we need to let's just check you out too." And so they was ready to almost set her up on dialysis, and not knowing that, and they were amazed that all her levels were all normal. She just have a condition dealing with her platelet count, but they did not know that everything else was normal. Her kidney function, this, and all the other tests were normal. They were like in shock. And that's had been because her doctor really sent her home and said there's nothing else we could do. And I said, I'm sorry, I'm not a medical doctor. I am a nurse practitioner, and I have a PhD in holistic medicine. But my premise is God comes first. I don't care who you. In my case, who I am or anyone. And I think people should not tell people you have a month to live or a week to live or you
Right.
have this condition, that condition, because of the fact some people are not strong enough and they become a self-fulfilled prophecy and
Right.
they die. In that, at that same moment, the same day that someone told them this was the day you're going to die. And
Right.
others will say, you know what? I'm not going anywhere. I'm not going anywhere. I'm going to change my diet. I'm going to do this. I'm going to become more proactive and take better care of myself. I'm going to let go of all that negative stuff that I'm holding on to and an unforgiving heart. I'm going to let go of all that stuff and I'm going to move forward.
And there are always people that beat the odds. Every day, you and I have seen it. I mean,
Yes.
my mother has outlived 2 husbands and a boyfriend. She's a 2-time cancer survivor. She's 87, and she has all of her marbles. And I just hope I take after her in the memory department.
Oh, wow. 87. Oh, my
yes,
goodness.
she has an
And my
incredible
grandfather's still
attitude.
alive, too. He's 99. So,
Yes, it's really, and I would also. It's so interesting what you said. If I could mirror it for a second, because
yes.
it's not even a cardiac problem. But one of my patients came to me a couple months ago, and I noticed that he was anemic, and his doctor, whose name will go unmentioned, said, "Okay, well, I'll just put you in iron." I said, "Wait a minute, we got to find out why this is happening. We don't just put
Yes.
someone on
Yes.
iron." And come to find out, and I'm not a hematologist, but I have I'm board certified in internal medicine, so I know what basic tests to order. And then and most of the tests were pretty normal, so I sent him to a hematologist, which was the appropriate thing to do. And come to find out, he's not producing any blood cells. He has a myeloproliferative disorder, which is unfortunately not curable. Now, what in
Yeah.
the
Well, that's,
world is
that's
iron
like,
going to do?
yeah. Mhm.
And it's like that's not my specialty, and I'm not trying to, give myself an award for that. But it's like I always try to say to myself, and I know you're the same way, Dr. Lee. Well, what does this mean? Why is this happening? And let's not just put a Band-Aid. And that's the problem I see with not just cardiology, with modern day medicine. And I think with HMO medicine, to think about, well, if you spend more than 5 minutes with a patient, you're not cost effective. I really don't care what's cost effective. I care about the patient.
I know. That's why I didn't last long. Well, actually, if I had
Me
not
either.
resigned, they probably would have fired me because I always stayed longer than 5 minutes. And I was actually on the triage committee of one of the HMOs that I work with. And it's amazing. They didn't like me there neither because the triage was, oh, tell them to set up an appointment in 3 days. I said, well, what if they're not here in 3 days? How do I tell a mother with a baby with a temp to give it something and come make an appointment? I think with a temp, I need to tell her to bring it in because I don't know what's going on over the phone.
Oh. I just
But
want
I'm
to say
telling
it's
you,
a
the triage,
privilege that.
and
It's
actually
a,
they have changed their name. We do
right.
have a caller. I'm sorry.
Yes.
Uh,
Good.
Caller, can you state your name and where you're calling from? And thank you in advance for calling in.
Oh, yes. Hi, this is Linda, and I'm calling from Los Angeles.
Thank you for calling in, Glenda.
And I was just calling to ask about different heart medicines, like for blood pressure and that X-Forge, and wondering if he knows anything about X-Forge, if it's good for you.
Well, X-Forge, I mean, I can't, it's hard to really comment on an individual medication. It is effective for blood pressure. But one of the things, since you're a woman, that you might want to know about, and this just recently came out in the last few weeks, and I haven't had time to scrutinize it in detail, but one of the components in X-Forge is amlodipine, which is a calcium channel blocker, and which is very effective, I should say, in lowering blood pressure. But now the latest reports is that there actually seems to be an increase in breast cancer in women who have been on a calcium channel blocker for more than 10 years. So this is new information, and it's definitely raising an eyebrow. I can't comment on it because I haven't had a chance to research it and or scrutinize that particular study, but it certainly gets me a little concerned.
You know, there's a lot of
extra
people
vitamin C help? Extra vitamin C, does that help?
I don't really know. I mean, if a drug has any propensity to cause cancer, I just get very worried. But I have to tell you, it's very effective in lowering blood pressure.
Yeah, okay.
That's about all I can really say.
Okay.
Yeah, you know what? I did hear something about it. I haven't had a chance to investigate that. I think it was one of the calcium channel blocker
Hmm.
that said that was leading to cancer. They never said which medications it was, but that's one of them. So
Yes,
that's good to know because X-Forge is actually a very expensive medication too.
expensive and widely used.
Yes. And it's amazing. I know for women it's breast cancer. I think they said for men would be prostate cancer.
Right. That's my next question. Okay, if you're going to come out with the next 12 months, that also in men it may because these are both hormonal driven cancers. So we don't know the answers to these questions, but the calcium channel blockers are widely used for the treatment of hypertension. So it underscores the need to really overutilize exercise and diet and stress management and everything we can in the treatment of hypertension. And I mean, we do need medicines. I can't say we don't, and it still is our number one risk factor for heart disease and stroke. But drugs are not always the answer, and there's no panacea.
No, and to do all of the above is what we need to do. The
Right.
exercise, diet, stress, those are some major factors because that stress hormone, when it starts to increase, there's a multitude of problems with that. But at least
Right.
on the X-Forge, Glenda, know that. Yeah, it was something in the media about that. So now we know that one of the ingredients, because actually it's two major
Right.
combining two major blood pressure pills together. So I'm happy to know that. And at least you were able to hear it here, but it was, I know, in the media. So breast cancer, we have to be very careful with.
Yes.
Absolutely.
Okay. Well, thank you, doctor.
You're
Thank
welcome.
you.
Thank you for calling in. I really appreciate it. Thank you.
Bye.
Bye-bye.
I just want to make sure, Dr. Lee, that did we address everything you wanted to on EECP before? I just wanted to make sure that everything was addressed. There's so much to talk about. I guess as a final note, I would just want people to know that that there is room for intervention. If you come to the hospital with an acute heart attack, yes, that's when you want to have an acute intervention. A stent can save your life, but there are so many unnecessary procedures out there for chronic angina or angina that it has been shown that medical therapy is as effective. And of course, EECP is under that auspices of medical therapy. So I just want to make that distinction that people need to know that this is an option for them.
Right. And I'm so glad that you brought that up again, but I kind of want to go back to medication because I was watching something late at night. I just happened to have the TV on. It was on, and I kind of glanced at it, and now there's a class action lawsuit with people who were taking the Z-Pak, which is an antibiotic, because
Yes.
it leads
Yes.
to heart disease,
Mm-hmm.
heart attack, chest pain, atrial fibrillation, and death.
Mm-hmm.
And there was actually several people that I know during the winter months told me they went to their private doctor and they wanted to go ahead and take the Z-Pak. And this is what happened. They end up, and I kept wondering, why did this person who had great heart, taking supplements, doing exercising, in good shape, have a heart attack? It was
Mm-hmm.
just amazing how this happened to the person. So it's already out there, and there's already websites. But a lot of people were taking because it was an easy way to get rid of a virus. They thought to take a
Right.
4-day, round of antibiotics. Antibiotics.
I'm really glad you mentioned that because obviously in a cardiac practice that's of concern. And yes, it could zithromycin, which is the thing in the Z-Pak, which is widely used, probably more than anything else that I can think of, can cause cardiac arrhythmias. And I understand now, actually, that they say it actually can cause QT prolongation, which I know to your audience doesn't mean much, but it's an abnormality on the electrocardiogram that predisposes one to sudden death. It's a serious problem, and a lot of medicines can cause that. But we didn't know about that. This all came out the last year or so. But I think it's interesting that doctors use this for all these virus infections, and basically, you and I both provide intravenous therapy, which is probably more effective in getting a cold out of the way since most of these things
Oh,
are
most definitely. Our
viral.
wonderful vitamin C IV therapies
Exactly.
and
So, I mean, the
glutathione.
antibiotics are overutilized.
Yes, they are. But we definitely know that. But in lieu of knowing that one of the several of the blood pressure medicines can now lead to breast cancer, and now an antibiotic can lead to heart disease, or any other medicines. This is why it's so important that instead of just taking supplements, if you're under a doctor's care and you want to see someone who have a background in both, like my wonderful guest here, Dr. Elkin, and or myself, we're going to investigate, what medications you're taking, everything. I keep my PDR handy. I have other material, and I'm going to, make sure that everything that you're taking, if you're on meds, that there's no contraindications, number one, in taking a supplement. And then secondly, not only that, to make sure that whatever you're taking is not depleting you of something else. Because a lot of the blood pressure medicines, too, have depleted people of their calcium, and they didn't know that.
Right. And they can increase your uric acid level and make you predisposed to gout. There's a lot of things, right?
Yeah. So what have been some of before the latest two, which is the antibiotic and Z-Pak, and then the X-Forge, the beta blockers, calcium channel blockers for your blood pressure meds. So if you're taking blood pressure medicine, you really want to see what it is you're taking, or ask your doctor. Better yet, you can always ask the pharmacist. The pharmacist will let you know.
Right. And, I think you will agree with me, Dr. Lee, that, this is why I'm against the cookie-cutter approach to medicine. And, of course, that's what everybody wants in hospitals and so forth. I guess they call it practice guidelines, and you as a nurse practitioner background probably are more familiar with this than me because you've worked probably with quality assurance and so forth. But they're trying to make everything so cookie-cutter, like one size fits all. And with the knowledge we're getting every day, we really can't use that approach. I don't think it's going to work. What do you think?
It's amazing you said that. You say that because that's why I stopped working for HMOs, because I saw that was going to be a problem. I mean, and it's amazing. You have people who go to medical school and spend all those years, and then they give you a booklet and tell you this is our protocol for a person who walk in the door with a blood pressure of this level, a cholesterol of this level. It's like then you don't even think for yourself anymore. You just follow their guidelines at the hospitals. And I'm thinking, my goodness, it's like you're saying, the cookie cutter approach. And everybody does not fall into that.
Right.
And, there's been a lot of good, and I'm not putting down HMOs. I'm very grateful that, I hopefully never have to go to one, but but I'm not putting them down. I used to work for them. So you have good and good doctors who are conscious. And one of my patients, I was amazed that her doctor actually, from an HMO, put her on something natural for her cholesterol level.
Wow, that's impressive.
Yeah, I was so impressed. I said, I have to meet this person. And what was impressive, too, there was a person who called me, and this person's family member went into atrial fibrillation. And the first thing the cardiologist asked him in the ER, because this is a young person, do you smoke marijuana? Yeah, so he said he's finding a lot of cases of people who smoke marijuana going into atrial fibrillation.
Well, that's something I didn't know, so thank you.
Yeah, well, no.
I see a lot of atrial fibrillation.
Yeah, I would have known if they had not called me. And one person is using it for medicinal reasons.
Right.
And she had been on my mind. And I said, I need to call her because she's out of state and just see how she's doing. And she said, it's amazing. I'm just getting home from the hospital. And I'm like, for what? She said, I don't know. I keep having this atrial fibrillation problem. And I asked her, I said, are you still using the marijuana for medicinal? for your condition? And she said, yes. I said, did you smoke it that morning? She said, yes. I said, well, why don't you check? Because, this was just
Yeah,
told to someone I know, one of their family members, that this cardiologist said it's linked.
that is great information to know because, these dispensaries are all over in the state of California.
Yeah. And the thing about this, the person is they said, no, I didn't smoke. I did not smoke. And so they did blood tests on them anyway and said, well, we found it in your system. He said, no, I ate a cookie. I didn't smoke it. I ate the
Okay.
cookie.
It still got in the bloodstream.
It still got in the bloodstream. So, my thing is, when I just think a lot of things out there, people, I need to be careful because I just think a lot of things have been adulterated and altered when it's so readily available for you to just use your own discretion and be careful.
And I agree.
Well, we still have a little bit more time to go. Is there something you would like to say? We're not closing until we have at least,
Oh
I guess,
gosh.
about 20
Well, it just
or
wouldn't one
15
thing.
minutes.
Yeah, I think it's been such a great experience. And one of the things, people ask me, because I'm kind of known as the medical advocate, and they say, well, what does that mean?
Oh, I meant to ask you about that. Yes,
Well,
thank
yeah,
you.
well, what it means is that, I'm sure I'm your medical advocate if you come to me and I'm your physician, but what I'm really advocating is that you become your own medical advocate and that
Yes.
means the audience here, all your listeners, because no one knows your body better than you. There's no doctor or nurse who's inside your body who knows your body the way you do. So patients are laughing when I say, well, you know what, I'm your second opinion. They said, what? Yeah, I said, I'm your second opinion. You're your first.
Wonderful. I love that.
So I advocate that people become their own medical advocate, and that therefore they are in the driver's seat when it comes to their health, and it keeps them empowered. Because I think in the old days, people thought of doctors as gods, and it's there's only one God, and I certainly am not in that position, and I certainly am not perfect.
Neither am I.
So it's like I want my patients to be informed, to know about their options. This is why I talk about EECP, and do
You're
the
kind of
things that I
fading
do.
away on me.
Oh, am I fading? Okay. Can you hear me now?
Yes.
Okay. So it's all about giving patients options and making them feel empowered, and that's what I try to do as the medical advocate.
I agree with you. I totally agree with you. And I just want to recap, and I'm so glad you said that, though, about being a medical advocate, because that is so important. Here, I usually just tell people, this is a team, and you are the team leader. you know,
Right.
this is a team.
It's funny, I do
The
something
team.
similar. I say, I'm the quarterback, but you're the player.
Okay, because I don't play sports, so. But that's really great, and it makes the person feel more that I am not trying to take control of your treatment plan, your health plan.
Right.
This is something that we're doing together. So it's really important. Number one is you tell me everything. We can't hold back on anything, so that I can set up something that's going to help you to feel better, and we get to the bottom of why you're having the problems you're having. And believe me, I would research it to the end. If I don't know, I'm going to research, or I'll call my associates and people like yourself, and we're going to find out the answer. Because, nobody is born with all the answers. So,
No.
but I
And
would research
you
until I
say it
find
so well, because I agree with you. That's why we get along so well, because we are on the same page. And I wish there were more people. Like I say, you have to tap into these resources, and
Yeah.
they are out there. That you and I take the time to find them, and it's so important. And the patients are so much better off. So I'm so grateful for having met you and knowing that you're around.
Well, thank you. I just want to ask when we were talking about EECP,
Hmm.
the therapy, people who have pacemakers, are they a candidate for?
Great question. Yes, they are. They are definitely candidates. Usually, people with pacemakers have pretty much a set rhythm, or the presence of the pacemaker keeps the rhythm relatively stable.
Can you just speak up just a little louder? I don't know why
Yeah,
you're fading away a
yeah.
little.
It is, people with pacemakers or even people with defibrillators, by the way. Such devices are not a contraindication to EECP. Usually they're very easy to work with because the heart rate is relatively slow and controlled. So they get great effects on EECP.
Wonderful.
What we may have to do, Dr. Lee, and a patient that has a rate-responsive pacemaker, let's say, and it goes on muscle contraction, we may turn off the rate responsiveness for the duration of the therapy, and then we can easily do that with a magnet, which is put on the patient's chest. So we find out beforehand whether it's a patient that I put the pacemaker in or a pacemaker from some other doctor. I always find out what the device is. I have it interrogated before we start, and then I see whether or not it's rate responsive and so forth. And if it is, and if it goes on muscle contraction, since of course the body will be contracting when they're on the table, we might turn that switch off for the duration of the treatment and put it right back on afterwards.
Wonderful. And before we wrap up, we have a few more minutes. I just want to say, if you just tuned in, I really thank you for tuning in to the Cherilyn Lee Health Show .fm is our website, the Cherilyn Lee Health Show .fm. If you want to call in, you can call in today at 310-928-7733. My guest today is Dr. Howard Elkin, who is a board-certified cardiologist and internal medicine. So if you have any questions, who also is practices anti-aging. So he practices ways to keep us young. And, you have a book that's coming out. Would you want to share that with us?
Well, I was a patient. I think you've talked about some of your own experiences as being a patient. I think you really become a good practitioner when you become a patient. But
yes.
I was a patient twice in a span of 19 months, emergently for two unrelated reasons. And that's when I learned how to become a medical advocate, because I saw the loopholes in the system where traditional medicine was able to help me, but was not able to help me all the way. And I said, okay, this is my responsibility. This is what I have to do for myself. And that's really the history of this whole thing about me becoming the medical advocate, because I first had to learn it for myself. So I'm writing my book in my spare time. I hope to have the first draft finished by the end of this year. And it's
Yes.
very exciting because I want it to be, it's not just about my story, it's also got a fair amount of information for people to read about heart disease and also back disability. But I also hope it to be inspirational so that more people will read this and feel inspired to take the driver's seat when it comes to their health.
Wonderful. So we'll be looking for your book. Do you have a title?
Yes, it's going to be called From Both Sides of the Table When Doctor Becomes Patient.
I love that. That's really nice.
And there's a story behind the title, but I'm going to wait until I get closer to release the book before I tell you that, because it's kind of funny, but I'll tell you about it later. It's all personal experience, though.
Wonderful. And before we we end the show, we have a few more minutes here. I just want to really go over the nutritional components that are really great for the heart itself.
Okay, well, want me just to name them again?
Yeah, name them again and kind
Okay.
of go through it real quickly.
Okay.
Yes.
Real quickly, the coenzyme Q10, or commonly known as CoQ10, is important in the production of energy for every cell in your body. But of course, the heart works 24/7, so we really want to make sure we have ample amounts of that. And there are certain drugs that will deplete you of it, such as beta blockers and statins. You need to know that. Next is L-carnitine, which is important because it transports fat to the powerhouse of the cell where energy can be produced. And again, the heart muscle depends on fat for most of its energy storage. And third is the D-ribose, which is a 5-carbon sugar, and that's important as a raw material. You can have all the CoQ10 and all the L-carnitine in the world, but if you don't have the D-ribose, the cell won't be able to produce energy. So those three together, I call it my holy triad, but I have had patients with heart failure who are on medications who had very poor energy, and once I just put them on this nutrition, they improve remarkably. But you don't have to have heart disease to be on these nutrients, because they all get depleted as we age, and certain medications will also deplete them. Those
So
are my
it's
three
three.
big ones. Yes. There's other things, too, that I didn't mention before. Magnesium is a trace element, and about 55% of the American population is depleted in it. And it's important in about 200, and I think almost 300 reactions in the body.
Exactly.
And
Yes.
it's very important to help control the heart rhythm, also muscle contraction and relaxation, and it's very useful for sleep.
Wonderful. I know I used it during most people know I was involved with the trial. So I mixed up a little magnesium in my water and I kept sipping on it. And that's what pretty much kept me calm.
Yes.
hmm
It's
And my heart beating at a
right.
regular pace.
A lot of patients have palpitations, and I hate using medications for that, because the medications are worse than the palpitations, especially if they don't have heart disease. And it's a great way of quieting the heart. It really,
Yes,
really is.
just the magnesium.
Those are
So,
my big ones.
let's go back to the CoQ10. One quick question,
Yes.
because I think there was some studies before showed the CoQ10 that you should take it with vitamin E. Or are you just saying CoQ10? How many milligrams?
Oh,
Possibly.
great question. Well, it depends on what the condition is. If you're taking it for general health, I think 100 milligrams is fine. If a patient has a history of heart failure because any diseased heart is going to be really depleted in it, I would go to 400 milligrams in divided doses.
hmm
And if the patients aren't doing well, I would do what's called a CoQ10 level. You can actually do a
Do a blood
level.
test. Yes.
Yes, you can. And
Yeah.
Quest will do it, and they send it out to a specialty lab. But we
hmm
can actually measure the CoQ10 level, and I go with that because some patients need more. It's also used in some neurologic disorders, Parkinson's, migraines, and other things. But for the
Right.
heart,
Because
I would go
I
up to
use a lot of CoQ10 here.
right. So, but 1 to 200 milligrams for average, and then I go to 400 or 500 if they have a history of heart disease. But here's the important thing. CoQ10, which means the medical term is ubiquinone because it's ubiquitous in nature. But even though that's true, it's a very large molecule. It's not well absorbed. So you want to get a good one. You don't want to get a crummy brand. I'm not knocking down Costco or Trader Joe's, but you want to have a quality one without crummy fillers and things like that in it.
Yes.
Because and it should be a gel cap, and it's fat soluble. Like vitamin E, I think that's the association. Vitamin E is a fat-soluble vitamin. Coenzyme Q10 is fat-soluble. So you want to have it with food because you need a little bit of fat for it to be adequately absorbed.
I'm glad you said that, to take it with food, because that's, these are things that I take myself. And people are like, gee, how do you have so much energy? Well, it's what I'm taking, it's what I'm doing now. So
Right.
I try not to burn all the candles at every end and in the middle. That's what I had to slow down and stop doing, because that was me for a long time. So, and it's amazing how much energy you feel, but I never really feel tired. So, but they're very important to take that. So definitely take the CoQ10 with food, especially if there's fat in the diet, which is important. Really important. So we have covered quite a bit on this show, and I am so grateful to have you as a guest here. And I just want to say, if you have anyone with cardiovascular disease, heart disease, if you want to just hit those really quick indications, we're going to, let you know, EECP, you are a candidate. So again, who are candidates, likely candidates, prior to maybe all the physical and examination, but what would bring that person to you to be examined?
Well, a great way is to go on my website, which is www.heartwise.com, and has pretty much most of my services, and I have a section on EECP. I also have several very short videos that I made over the last year that tell you a little bit about some of the things that I'm most interested in, some of my pet peeves. You can also call my office. I can be reached at, actually I use my office manager because she's easier to reach than me, and that's Mary at heartwise.com. And if you have any inquiry, even if it's, just something in general, they can always call Mary, Mary, at heartwise.com and say, as per Dr. Lee's program, I have this question, and if we can answer it, we will.
Okay. We have Tony from Facebook who has a question.
Sure.
And he wants to know, his question is, to help with anti-aging, he had a debate with a friend of his that CELLBACY can slow down or reverse the aging process.
What is it again? I'm sorry, let me say that again.
C as in cat, ELL, B as in baby, ACY. I just want to make sure people hear the term. Cell brace can slow down.
Why haven't I heard that before? CELL. Is it ARY?
CEL. Me and my glasses. CELBACY.
Have you heard of that?
I'm sorry. It's actually my computer. So it's a computer. He's sending this to Facebook. CELIBACY.
Okay, CELIB like in boy?
CELIB as in boy, ACY.
I'm not familiar with that.
Yeah, he said that he had a debate with his friend who said that this can slow down or reverse the aging process. And what do you think?
Well, first of all, not that I know it all, because I certainly do not, but if I haven't heard of it, I'm a little concerned because there's so much marketing hype out there, and I'm sure you will agree with me, Dr. Lee.
Oh,
you don't
yes.
know what to believe anymore. But that is not something that I'm familiar with. I will be more than happy to research it.
Oh, so would I, because I haven't heard of it neither.
No, okay, so that's two of us that have it, and we pretty much keep up to date with these things. And you have to be really wary about some of these things that you hear on the Internet because, you can go to any condition, and they're going to have all these remedies for it. So there's a lot of information on the Internet that is useful and helpful, and some of it you have to be able to. That's where people like Dr. Lee and I come in handy because we can do that work for you because we have the background. Because there's so many things out there. You could have very expensive urine if you want it. Do you agree?
Oh, yeah. Very expensive because everything just went straight through the body and it wasn't absorbed anyway. I want to say that I want to say personally, quickly, the best way to stay young is to get yourself some sleep.
Right.
That
so
is the fastest and the best anti-aging without taking a pill is to make sure you're trying to get at least 8 hours of sleep. Anything over 5 hours because the body then is releasing that wonderful hormone and which is going to help you to stay healthy. But if you want to stay looking young, just make sure you're getting enough sleep. And that's the fastest. Drink your water. Some simple things. You don't want to dry the skin out. Takes your good fat. I love coconut oils.
Yes.
And then there's others. But anti-aging is really take care of yourself. Watch your stress level. You don't have to take a lot of things. Your markers, your inflammation markers are so important. And when I say that, your doctor can run them. You can just tell them you want to check your inflammation markers. Those are very important. So if you don't have a lot of inflammation going on, then you don't have a problem there.
I may just want to add one thing if I have a second because I'm like you. I check inflammatory markers on all my patients. In fact, if you go to my website, one of my short videos is called Anti-Aging Pearls #2, Inflammation, because inflammation really is the bane of our existence when it comes to aging. But anyway, I'm sure you and we check C-reactive protein levels on everybody, and I would say more than not they're elevated, okay? And one thing that causes it is obesity. Another thing that causes it is lack of sleep, by the way. Sleep deprivation is inflammatory in nature. So I'm so glad you brought that up. But I also, if I have worked a patient up and they have chronic elevated levels, now I'm saying, you know what? Because I used to say, do your gums bleed? Do you go to the dentist often? And they always say no. Now what I do, I circle the level, and I give it to the patient and say, go to your dentist and ask them, is there any possibility that my oral cavity could be the cause of this elevation? And if they don't know, they need to find another dentist or go to a periodontist.
Oh, that's great, because we've dealt
That
with a
is,
lot of
and all my
holistic
reading,
dentists on the show, so that was very good.
it's the most common. That is one of the most common sources of of inflammation is from the oral cavity. And I did that.
Yes.
I recently did the research for my book, so that's why this is so fresh in my mind. So I really want to spread that word because I'm making a big deal about it because inflammation on a chronic basis is not good.
No, it
if
isn't.
you want to stay young, I don't know about all these supplements, but you don't want to be inflamed for 24/7.
No, you don't. No, you do not. And we're down to our closing, and I just want to say again, thank you so much, Dr. Howard Elkin, for being a guest today on the Cherilyn Lee Health Show. And with your host, Dr. Cherilyn Lee, I just want to thank you so very much. And I'm hoping that share this. This show will be on our YouTube channel. So if you go to our YouTube channel from the Cherilyn Lee Health Show, you will be able to find all of our shows, and this show will be there. Please share this with your families. Send the show to loved ones in other cities, states. But please pass it on. I just want to say, because this is the reason why I take the time to produce a show of this nature, is to disseminate information that's going to help us to have a much more quality of life. It is very important to me, and it's one of my number one passion. And I always try to find guests who is their passion also. So I want to say in closing, repeat after me. You know how I do this. Repeat after me. I am so grateful that I am a magnet for miracles. I want to thank the Healing Frequency Interlight Radio for another chance to be with you this Wednesday. Have a wonderful and blessed day.